Yes. Oh, do you want me to go back? Yeah, let me go back. Vascular dementia is just as it sounds. So it's through like the vascular, like a lot of it has to do with vascular diseases, like cardiovascular diseases, high blood pressure, or like diabetes. So it's when these conditions often, maybe they can cause like a stroke, and then the stroke causes the loss of oxygen to the blood, to the brain, and so that can cause dementia in a certain part of the brain. So typically we see like people who had a stroke can develop vascular dementia in a particular area of the brain. So the most common dementia is Alzheimer's disease. So this is like all of the other diseases, types of dementia. It does get worse over time, slowly. And so we do see that it can change personality, behavior, and there's, limited treatment. Like there are medications that could help, but ultimately, it is a fatal disease, and we do not have a cure for it at this time. Yes.
Someone has thought of memory lapse or something like that, and it's diagnosed as dementia. But they keep saying, I know I don't remember as well as I used to, so they're aware that they're not remembering. Would that be the 90% side, or would that be the 10% side that maybe they're going to regain their memory?
Mm-hmm.
If they're so aware that they're not remembering like they used to.
So, I mean, it depends on what else is going on. So I can't really say for certain because I would need to see their whole like health file and see all that, but I wouldn't do that anyways because I'm not a doctor. But I will just say that there are people who are living in early stage Alzheimer's that are aware that their memory is not that good and that they are forgetting. And so when they are so aware, that's when we do see like more frustration or maybe depression set in because they are kind of aware that they're not remembering very well, or they may even be aware that they have received the diagnosis. But what we see typically is that a lot of people are not getting diagnosed until they're maybe almost entering the middle stages. And by that point, they may not have that same awareness as when they did earlier on. So that's really all I can kind of say in that regard. Yeah. Yes. Hi.
Aware of medication is not going to cure dementia. It might slow it down.
Correct.
So when is it a good time to administer medication to the patient?
Yeah. So I know I've read like studies and research that just show when with medication for Alzheimer's, it's been shown to be more effective taken as early as possible, like in the earlier stages of the disease, because it has been shown to be more effective earlier. But there are medications for like moderate, like middle stages of Alzheimer's. Yeah. So we see that with Alzheimer's disease specifically, experts say that it's like a disease of emotions because they really don't have a lot of control over their emotions and their behaviors. But I want to explain how behaviors occur, right? They typically don't just happen out of the blue, right? It does have to start from somewhere. So, and that somewhere is confusion. So confusion is really that central reality for a person with Alzheimer's. They are living in confusion on a day-to-day basis, and just they're having difficulty understanding the things around them. And so there's that confusion, initially as that kind of initial issue for them. Then when there's confusion, that can produce discomfort, right? It's very unsettling to not understand what's going on around you. And that is when the individual can start to feel very uncomfortable. They can start having more like an emotional response to that discomfort. And then people just think about when you might be uncomfortable in a situation, typically then you might react in a certain way, right? You behave. So then you do something. So that action is that behavior. And those with the Alzheimer's also, they behave. So that's when we might see those, what we might call challenging behaviors or negative behaviors that we find difficult to understand or difficult to manage. But as we see, that occurs in some steps, right? It doesn't just happen. So that is why, as a caregiver, one of your roles is to kind of see when that confusion is setting in and see, okay, what can I do to help keep that confusion down and so it doesn't escalate? That can either be offering like reassurance, comfort, maybe redirecting them, trying to distract them from whatever it is that is causing them that confusion, or maybe offering maybe some support by helping them with a task that they are finding too difficult in that moment. Because it's also important to recognize that behavior has a meaning when they behave. It's a form of communication. It's a language, right? So when we see a behavior, we need to think, okay, what are they trying to communicate to me with their behavior? So let me ask you all. So we know communication is, verbal with words, but beyond just words, what are other types or other ways that people communicate, or ways that people get beyond words? What are some other forms of communication? Actions. So yes. Like anger. Yeah. So like emotional. Yes. Anything else? Any? Facial, yeah, facial expressions, absolutely. So let's see, so 55% of communication beyond just words is body language. So that could include like actions, facial expressions. And 38% is the tone of voice. So that could be like, what kind of emotion are you exhibiting through your voice, right? Are you angry? Are you sounding annoyed or frustrated? 7% would be the content and words used, right? So what type of words are you using, right? How are you expressing, yourself to the other individual? And so it's important to take this into consideration when you are communicating with that person with any kind of dementia. So I'm going to share 5 tips on how you can maximize your communication. And then after that, we're going to do some scenarios together and see what would be a good response to do in those cases. So the first one is to be an active listener. So you want to give the person your full attention when you're speaking with them, express interest, and try not to interrupt them, because especially, we know that language starts to decline. So they might need a little bit more time to get the words out, a little bit more time to process what you've just told them, and to think of a response. You may also want to focus on feelings. So again, because they may not be able to put into words maybe how they're feeling, but maybe they are smiling and happy and feeling really excited about something, but they can't quite get the words out to tell you, then just focus on the feeling and say, oh, I can tell you're really excited about that. You're really happy right now, right? So maybe just validating the feelings that they are showing to you. And of course, be patient, right? Patient with allowing them the time to communicate with you. The second is to create a connection. So it's may not always be about trying to get the message across or the information, but it's really about trying to facilitate and encourage that connection with your loved one by making eye contact with them, showing that you're actually listening and interested, by making that eye contact, by maybe using touch or gestures, right? Maybe holding their hand or putting a hand on their shoulder or arm, just having that physical connection, which is often lost as people get older, right? And, which is really sad because we all need that physical touch and attention there. Using a calm voice, right? So just speaking, simply and slowly and calmly, so they're really listening and really kind of trying to process what you're saying. Because if you're trying to speak very quickly or very excitedly, that could overwhelm them because they might not be able to process everything that you're telling them. And just, take your time, right? Take your time with them. Number 3 is to check the environment. So as the disease progresses, it can be really hard for them to stay focused and because they're much more easily distracted. And so just being mindful of that and knowing that. So that's why when you're speaking to them, right, being in plain view, maybe approaching them from the front so they see you, especially when you're trying to speak to them. Avoiding too much bright light or dark settings, especially if it's too dark for them, right? They may not be able to see, or it could cause them, maybe they get scared, like if it's too dark, or maybe you want to set aside a quiet place where there's minimal distractions to have that connection if you do want to facilitate a conversation with them. And just being mindful of noise, television, especially, television, because sometimes it could be upsetting for them what's on the television because they may not be able to understand or process what they're seeing. And sometimes people could mistake that, those with dementia could mistake what they see on television as a reality and kind of what's actually happening to them. So just being mindful of that, it can be helpful. Right, so if it's noisy, you close a window or you turn off that TV or turn off music, if you're finding that all the excess noise is upsetting to them. Number 4 is to adjust your approach. So meaning you want to change how you might respond, right? So those with dementia are not able to change, right? They can't change how they're going to behave or communicate. So it's up to us or the caregiver to think ahead of, okay, how am I going to approach this? I want to talk to them about this, communicate to them, and I want to think ahead of how I'm going to tell them, right? If you're trying to give them an instruction, maybe give just simple instructions like one step at a time. Or ask one question at a time, right? The key is you just want to be very simple and one instruction or question at a time, and being mindful of how you're expressing that information, right? What is your face saying? What is your body language saying to them? So just being aware of those. You want to show positive and friendly facial expression. And number 5 is to focus on abilities. So because dementia is progressive, especially as we see with Alzheimer's disease, their abilities start to decline over time. So you want to consistently assess their abilities and kind of see what skills do they still have, how much help do they need. And so that's why matching activities to their abilities can be helpful, because we want to maintain their independence and allow them to do as much as they can to give them that sense of autonomy and that dignity. And so you want to encourage that. and give praise or compliments, right, when they do something well, or try to offer some support or help if they need it. And as mentioned earlier, right, responding to the feelings rather than words, right, just responding and validating their emotions and what they're feeling in that moment. And having a routine can also be really helpful because it gives them a sense of like familiarity, and they get familiar, and it can make them feel secure and safe when they have that consistent routine each day. Some additional tips that are helpful is to repeat the instructions the exact same way and use the same words, same sentence structure. Accept the blame when something is wrong, which can be really hard if you know that you didn't do anything wrong, but sometimes just accepting the blame and saying, oh, I'm sorry I didn't tell you that sooner, or I'm sorry that you feel that way, I would be really upset too. Maybe you leave the room because you want to avoid a confrontation and you have to just give yourself a few minutes to kind of calm down. Agree with them. Often we say it's just easier to sometimes just go with the flow with what they're saying and just agree, rather than trying to reason and make them see what the truth or reality is. You can distract them, right, by redirecting them into another room or offering a new activity. Or you can slow down by how quickly you're speaking to them or how fast you're moving. The less helpful things is reasoning, right? So they say, you'll never win an argument with a person with Alzheimer's. So you don't want to argue or confront because you'll typically get the same results of, just over and over again. And there's really, it doesn't do the situation any good. Try to avoid reminding them that they forgot because they won't understand, like, well, what do you mean I forgot? No, they might say, oh, you never told me. And you think, yes, I told you, like I'm telling you every hour or every day for the last week, right? So you have to take it as if it's the first time that you're telling them. And avoid questioning recent memory or like quizzing them, right? Like if you're pulling up to their house, avoid doing things like, oh, do you know where we are? Or do you remember what did you do this morning, or who came over, right? Because as much as we want to kind of see where they're at and how much they are remembering, we don't want them to be upset if they don't remember or don't answer those questions in the right way. And above all, don't take things personally. Don't take it personally, right? This disease makes them act and behave in certain ways that it was typically not what they used to be like before. Some other helpful suggestions is last word connection. So this technique can make somebody with dementia feel like they're in control of decision making. So, for example, you might say, do you want to wear the green shirt or the blue shirt? And typically they will say that they want the blue shirt simply because it's the last thing they heard. Or maybe you say, do you want a ham sandwich or a turkey sandwich? And they might say turkey because it's the last thing that they heard. So that does empower the person with the dementia to feel like they are helping to make decisions. And then you're also offering them those choices. You're simplifying the choices for them so they don't feel overwhelmed, but you are then giving them the two choices. Other forms of communication, just like I mentioned before, like giving them praise and complimenting can be really, make them feel really good. And humor does still remain the best way to communicate, just laughing at each other, laughing with each other, maybe watching a funny show, or, funny home videos or something that you have, right? So that in itself can bring a lot of pleasure. But even you as a caregiver, maybe just finding humor in the things that your loved one does, because sometimes maybe they start doing these really quirky, odd habits that they never did before, and maybe there's a way for you to find the humor in those types of things. So we're gonna go through some scenarios here, and I want you all to think what might be some responses. So the first scenario we're gonna deal with is to avoid reasoning. So you've told your loved one that we got to go to the doctor's appointment, and they say, "What doctor's appointment? There's nothing wrong with me." So what might be something that you don't want, a way not to respond? So what would be like not the best way to respond in this case?
Not remembering the appointment.
Yeah, like saying like, "Don't you remember don't you remember?" Yeah, yes. Any other ideas?
You must know why it's full, the reason why it's full.
Yeah. So let's see here what would be not a don't. So you may not want to say, "You've been seeing the doctor every 3 months. It's written in the calendar, and I told you yesterday." So see, you're reminding them that they forgot, and which is probably not what you want to do, right? Reminding them that they forgot. So what might be a better way to respond? What do you think? What would be a better way to respond? Yeah,
The doctor called and just wants to check that you're okay.
yeah. The doctor called and just wants to check that you're okay. That's good. And then, so yes, pretty much just that. So a good response would be, "Oh, it's just a regular checkup," right? A short explanation, right? It's just a regular checkup. Or maybe you accept the blame. Maybe you say, "Oh, I'm sorry, I forgot to tell you," right? "I'm sorry, I forgot to tell you." So that would be an example, like when you accept the blame, right? Because they think, right, because they don't remember, and they think that they don't, they forgot about the appointment, and they think there's nothing wrong with them, and so they assume that you didn't tell them, right? So you just say, "Oh, I'm sorry, I forgot to tell you." Let's look at scenario 2, which has to deal with avoid reminding them they forgot. So your loved one suddenly says, "Oh, Joe hasn't called for a long time. I hope he's okay." And they forgot that they have already spoken to Joe recently. So what don't you want to say? Yes?
You just spoke to him an hour ago,
Yeah,
or 2 hours, or yesterday.
yes. Yeah, you just spoke to Joe. Yeah, don't you remember? Yeah, you just spoke to him. Yeah, that would be a good way. So you can say, "Joe called you yesterday and you talked to him for 15 minutes. Don't you remember?" Yeah, so you wouldn't want to say that. But what would be a better better response? Any ideas, any suggestions?
Let's give Joe a call.
Yeah, let's give Joe a call. Anything else? Any other ideas?
Even refocus on the positive part, Joe's doing well.
Yeah, Joe's doing good. Joe's doing well, yes. Okay, so let's see what this says here. So, "Oh, you really like talking to Joe, don't you? Let's call him when we get back from our walk." So in this example, they reassure and validate their feelings that obviously they like talking to Joe since they're thinking about him. But they distract them because, oh, maybe it's not a good time to call Joe or right now. So they say, let's call him when we get back from our walk. You take your walk, and maybe that helps them get their mind off of it. And because maybe, you know, it's not a good time to call Joe right now. Or yes, or you could also say like, oh, I just spoke to him and he said he's doing well. And he says, you know, hello or something, right? Yeah. But yes, but typically when we see that they all of a sudden are talking about someone or think about someone, right? Typically it's because they're missing them or thinking about them because they really like talking to that individual. So that is a good opportunity to validate that feeling and saying, oh, you really like talking to, you know, to so-and-so, to Joe. Let's look at scenario 3. This one has to do with avoid taking it personally. So the wife may say, who are you? Where's my husband? So we see in this scenario, she has forgotten who her husband is and does not recognize him in that moment. So what might not be the best thing for the husband to say in that moment? Yeah, don't you forget, what do you mean? Yes, yeah, yes, so saying, what do you mean, who's your husband? I am. Yeah, because that wouldn't be the best, because in that moment, she doesn't recognize that is her husband. And so trying to reason with her that, no, I am, can just cause more confusion for her when she doesn't understand that, and cause her to be more upset. So what might be a better response? Any ideas? What could you do in this scenario? Yes?
He's running an errand right now, he'll be right back.
Yeah, yeah. Saying he's running an errand, he'll be right back. Yeah. Any other ideas? Yes, so we can, yes, oh, he'll be home for dinner, right? You go with the flow and reassure them he'll be home for dinner, or, you know, he'll be right back. And maybe you distract them. Oh, how about some milk and cookies? Or let's have some dinner, or let's go have a snack, or let's sit down, you know, while we wait for him. He'll be home. So you distract, right? So some other strategies in this situation. One could be, well, one thing that can happen is that when they have this memory loss and they see their spouse, because remember, they forget the recent memory. So maybe to them, they remember their spouse, how they used to look when like they were maybe 20, 30 years younger. And so maybe saying, oh, like, maybe cracking a joke, be like, oh, you know, I cut my hair, or I changed my hair. Oh my gosh, I know, look how old we've gotten. And maybe you show a picture of like a wedding photo, and you kind of use humor to kind of get them back to the reality. You look through pictures of, you know, how you used to be, and maybe like how you look now, and like, oh, look at us growing old together or something. So that's one technique. I'm not going to say it's going to work every time, but it's a technique that maybe you could try, or just saying, oh, like, let's wait, he'll be home for dinner, let's look at some photos. And then you look at photos, you know, of your life together, and maybe that can then help kind of bring them back to the reality in that moment. So different methods there. So, okay. So in summary here, so I'm going to go back to the slides actually. Wait, here we go. So, right, be an active listener, right? Express interest. Create a connection, right? Make contact, use physical touch, speaking simply and slowly, right? To have that connection. Taking your time. Checking the environment, right? Of trying to reduce any distractions or things that could be triggering for them and overly stimulating, right? Or having a quiet place for them. 4, adjusting your approach. So you focus on how you're going to respond, how you're going to think ahead and communicate to them whatever it is that you're trying to give to them. And number 5, focusing on abilities, right? So, right, assessing their skills, matching the activities to their skills and abilities, and just really focusing on giving them independence and offering choices, right? So, maybe you give them 2, like I mentioned, 2 choices for like what they want to eat, what they want to wear. Minimizing choice is best because then they don't get overwhelmed with having too much information or having too many options to choose from. That's why we also see a lot like you may clean out their closet to like minimize the amount of clothes that they have and just kind of make it more simple so it's not so overwhelming. Something like that could be helpful. And then just to an overview of Alzheimer's Los Angeles, that we do have a helpline that you can call us. If you do need resources or have any questions, if you want to speak to a care counselor, so our care counselors, they provide one-on-one personal support to families. They can help you guide you through that journey and just be there for that support. And we have a lot of other great educational classes. Next month, we'll be wrapping up this series. That one, I believe, is making home safe. So that's tips on how to make the home safe and talk about safety issues that can come up in the home and how you can make modifications in your home. So hopefully you're all able to come next month to that one. Support groups. I know Lisa's Care Connection also has a lot of fantastic support groups that they offer, and our volunteering opportunities if you want to get more involved. Our website, alzheimersla.org, also has a lot of really great free resources on there, and then our social media channels as well, if you want to connect there. And before I open it up to questions, I did want to just make one announcement, and because I will allow for questions. Okay, wait. So on the table up front, there is, sorry, this one's in Chinese. Oh wait, there's an English one. There's Caregiver Wellness Day. Okay, so I invite you all to attend our Caregiver Wellness Day, June 28th. It's gonna be at the One Generation Senior Enrichment Center. And this is a free event for family caregivers. You're caring for someone with memory loss. And it's, there's going to be a lot of wellness workshops, educational workshops, things to really help you in your caregiving journey, as well as like pampering services, a resource fair, raffles, giveaways. We'll have continental breakfast, a catered lunch, a keynote speaker. So we're pulling out all the stops here. So it's really great. I invite you all to attend. I encourage you to scan or visit this link here to register. The sooner the better if you're interested. Registration is starting to fill up and we do have a cap. So I hope that you are able to make it and don't want to miss this really inspiring event. So in Reseda. Yeah, it's in Reseda on Victory Boulevard. Victory and Reseda, like White Oak. It's what?
It's near Lake Bellevue.
Yeah, thank you. It's near Lake Balboa, yes.
This is a really good event. You don't want to miss it. There's lots of good stuff for you. It's just to celebrate you, the caregiver.
Yes.
You, and we'll be there as well.
Yes, Lisa's Care Connection will be there. But yes, it is for the caregiver only. So if you have a loved one you're caring for, we do have a respite available. So we can provide respite care and have someone go and be with your loved one at home if you need that provided. Great, so I do want to take the time we have remaining to answer any questions that you might have. always like to save some time. Yes, sir.
These tips that you have given us, are they adaptable to a mild or advanced dementia?
Anything, yeah, it's any kind of stage, these are applicable to that, it's all, it's all the same, it's very, very good tips that you want to use really at any stage, yeah. Any other questions? No? Okay, I want to make sure that you also have, there's a communication tip sheet as well on the table up front. And so if you didn't grab that, please grab one on your way out. It's a compassionate communication tip sheet and has a lot more like do's and don'ts. And on the back, it has more scenarios like the ones we went through at the end. So I encourage you to grab one of those too. Yes?